movement matters. That is physiotherapy.
Okay, ready.
I'm ready.
Okay, I'm good.
I'm gonna repeat that.
We're ready.
For me, being a physiotherapist is all in.
Seeing the resilience in an individual is like the coolest thing ever.
Every single day, I get to help someone do something that they couldn't do anymore.
As PTs, I truly believe that we save lives.
Seeing their progress over time, helping them achieve their goals. That's what I love about physio and what makes it worth it to me.
One thing that really excites me is our expanding scope of practice.
We want to take the burden off of our healthcare colleagues in terms of things like x-rays, imaging. We're not sending a patient with knee pain back to fill up in the doctor's schedule to get an x-ray just for them to come back to physio.
Physiotherapists do often have the time and the space that can just help to alleviate some of the stresses in our healthcare system.
I think it'll have some big impacts in terms of the efficiency of how we do things.
By making physiotherapy as the first point of contact, we can prevent many conditions from becoming chronic.
So just imagine what impact we can have on the healthcare system and in patients' lives.
I think the single biggest opportunity is getting physiotherapy into primary care. Publicly funded, no referral required. That's our biggest impact that is completely underutilized right now.
Everyone talks about a medical system that is crumbling, that cannot handle the load that it's getting. They say that over 30% of what goes into an ER will be musculoskeletal pain. And we could be in the ERs assessing that.
We can help decrease emerge department wait times by the inclusion of physiotherapists to see those musculoskeletal conditions that take up emerge department time, but can be easily triaged and cared for by physiotherapists.
We are saving our emergency departments for patients who really need them.
So funding physiotherapy benefits the overall system because it keeps people out of the system.
If physiotherapists are able to be, more part of a circle of care, more part of, in hospitals, in family practices, will increase and improve care in huge ways.
It really doesn't seem like the equation adds up, but the fact of the matter is when we are looking at older adults, being able to have access to physiotherapy is a huge way for healthcare prevention, but then also healthcare recovery.
The goal is to improve somebody's level of being, level of life, decrease their pain, increase their function, so they don't have to access the system.
The people that we see really need the help and really needed the help like last year. So if we could increase our capacity to help, then we are mitigating downstream costs.
Funding has to support physiotherapy by physiotherapists to provide care to people in many, many different areas. Without it, we won't see physiotherapy by physiotherapists.
We're getting people back to work or back to sports. We're getting people back to the parts of their life that are important to them.
One of my most memorable experiences as a physiotherapist was helping a patient learn how to walk again.
I get to see people return to big things like being able to pick up their grandchild without any pain. Those are the type of outcome measures that I like to see.
After my treatment sessions, my patients feel more confident. They have less fear of going out for walks, being active.
That is the biggest achievement for any physiotherapist, to witness that day when our patient says, I got this now. Thank you for helping me through this.
If I were to speak to a government official, the one thing I would want them to understand is PTs are integral, and so we need to advocate for it, we need to push for it, and we need to make our voices heard, because that's the only way things are going to change.
And this is the time for us to come together and to really push forward for ourselves, for the next generation, and for Ontario as a whole.
We're going to see the system run smoother, stronger, faster.
And so then everybody wins.